Maine, lovely to see you. And if you are joining us from another part of the world, then we look forward to seeing you guys get a chance to see the recording. So, but we are here to answer any questions you have. It is a great pleasure to have two wonderful experts on two different topics. One of the things we like to do in executive education is bring these people together with different expertise. We find that real innovation lies in the valley between disciplines. That's how sometimes the biggest insights come to be. And so with that, we have a wonderful expert in nutrition and wellness, as well as a wonderful expert in the culinary arts. So it is our pleasure to bring this all to you guys this day or evening. So my name is Rebecca Tower. I am the Director of Executive Education here at the University of San Francisco. And I am joined by a teammate of mine, Cynthia B. You want to say hi, Cynthia?
Yeah, hi, everybody. Thank you for joining us.
Yes, absolutely. And as I mentioned, Marlene Janko, would you like to say hi, our Global Wellness Innovator?
Hi, everybody. Welcome. Welcome.
And many of you also have met Executive Chef Jean-Marc Folsac.
Would you like everybody?
Great, fantastic. Cynthia and I are here and we will be helping manage and the chat function. If you have any questions throughout this great presentation, please feel free to drop your questions or comments in the chat. We'll be paying attention to that and try to make sure you get your questions answered on this very exciting topic. And we will leave a little bit of time. This is about a 60-minute presentation, give or take, that will have a little bit of discussion between our two experts. And so we will leave a little time at the end. So again, if you have questions, then we will hopefully get those answered in a Q&A. But before we do that, it occurred to me, many of you are probably very familiar with the University of San Francisco, and some of you, this may be your very first time kind of being exposed to us. So we thought we'd give you a brief tour. This is our 55-acre campus, a collage of pictures from the Hilltop campus, which is located in San Francisco. It is right next to the Golden Gate Bridge, Golden Gate Park, near the Golden Gate Bridge, and you have a view of the downtown skyline as well as the Pacific Ocean. Really a beautiful place. Some of you may have spent 4 or so years there, you're studying diligently, so welcome back if that's the case. And the University of San Francisco was established in 1855, so it is the oldest university in San Francisco. It's also the oldest Jesuit university, second oldest Jesuit university in the US. Being a Jesuit university, we pride ourselves in Jesuit values of service, equity, inclusion, diversity, and also sustainability, and justice. In our diversity rankings, we're usually one of the top universities in the entire country in terms of diversity of our student bodies. So usually second or fourth, somewhere along those lines. So it's something very true to our hearts here. And sustainability, as any of you know from being in Northern California, is incredibly important, as well as in San Francisco. And our speakers will talk about that in a little bit. So our university here offers 150 different graduate and undergraduate programs, and we actually service about 11,000 students, support 11,000 students, most of which are in the undergraduate, but we have about 4,000 or so in our graduate programs. And one of our additional programs beyond undergraduate and graduate programming is in executive education, and that's offered in our branch location. So. If we go to the next slide, we'll see our branch location. This is in downtown San Francisco. This is where we usually host our executive ed programs. We have been hosting executives and EMBA students, graduate students, even undergraduate students from all over the world, from 6 different continents over the last 10 years. We've enabled them to come to the University of San Francisco and learn about executive education topics, specifically in entrepreneurship and innovation. We've had thousands of folks come through, over 3,000. And really we pride ourselves in being able to, inspire and future leaders by educating folks and teaching people about entrepreneurship and innovation. And this program that we are bringing to you today is a little unique in that it's really not only focusing on some of our expertise in hospitality and management and those expertise that we traditionally utilize, but also some expertise for our dietitians or School of Management. So our School of Nursing actually is ranked in the top 10 in terms of schools of nursing throughout the country. And our university is typically in the top 20 or right around that, top 25 in terms of entrepreneurship. So this is really kind of a marriage of unique expertise that we're bringing together for you. But let's not hear about us anymore. Let's hear from our actual speakers who have donated their time and energy to put together a wonderful presentation for you to really help educate all of us on how we can make healthy food choices to better ourselves and better our environment. So thank you so much to Marlene Jenko, who is joining us today. She has a history in nutrition science, a master's also in public health education and promotion. So hopefully this initiative is right down her alley, so to speak. She's also a registered dietitian. She's also worked with many organizations as a wellness director or directing their wellness efforts, whether it was a consultant or actually at a company, kind of managing all of that to really help us all be healthy individuals. So we have Marlene, and we also have executive chef Jean-Marc Fulsac. So he is in fact an executive chef and instructor at the University of San Francisco. Formerly, he worked at the California Culinary Arts Academy. I believe he was a guest chef at the White House, which is exciting, no doubt, for the Clinton administration. But in general, just a world-renowned chef and instructor. We're very grateful to have his expertise, so he can hopefully help all us nutritional foods also enjoy them and taste good and be excited about these menus. So with that, I will turn it over to Marlene and to Jean-Marc so that they can.
Wonderful. Thank you, Rebecca. And I want to thank everyone for joining us. Jean-Marc and I have been so excited working with Rebecca and her team over many months, actually, to put this program together for you. It was so wonderful to see how many of you registered to join us. And I particularly was appreciative of knowing more of the reasons of why you signed up. For some of you, it was because you're a health professional and wanting to learn more about this topic. For some of you, you're doing it because you're interested in your own personal health. Some of you are in the hospitality, and some of you in the food service, some management, and some in the actual kitchen and private chefs. So it's very, very exciting. We might have missed a couple there too through my summary, but very exciting to see that. So thank you for giving us a little bit of insight about you. To get started, I thought you might like to know just a little bit more about Jean-Marc and I and some of the projects that we have worked on together. This is not our first rodeo, I guess, when I think about the years that we've worked together. In fact, over the years, we have joined one another to plan, prep, cook, and serve healthy options to really inspire, really inspire and teach others how to plan, prep, cook, and serve healthy options to their customers, patients, employees, and even their own selves. In fact, when we put all of our experience together, we were kind of laughing about the fact that we both are getting older, but we have over 50 years of experience. And through that, we really have seen firsthand, unfortunately, the ravaging effects of not eating healthy, what the poor diet can do to a person's health, and certainly what it can do to our nation, our world. We have had the opportunity in our working together in training. We've worked in environments like restaurants and hospitals, senior care facilities, universities, corporations, and government facilities. We've got the chance to train food service team members, hospitality management, health professionals, private chefs, and even we worked together to train the United States Capitol Food Service team and was invited to go to the United States Senate for 7 years in a row to do healthy luncheons. So we have a little bit of a history, and we deeply, deeply care about this topic, both from teaching individuals and all of the things that I've mentioned to you. So our goal then, and when we kind of revisit of all the things we've done and then where we're at today, our goal then, and really still today, continues to be to really help translate the science of health and nutrition into real life actionable steps. So real things that people can use, right? So how do you take all that information out there and then boil it down into steps that people can use, really to integrate healthy, delicious, sustainable whole foods that promote a healthy body, a healthy mind, and certainly a healthy planet. But more when we're in the moment, more than ever with the COVID pandemic, certainly the chronic disease epidemic and the ultra processed food epidemic of today, there certainly is an urgent need to do more, which is really what has brought us together today. And we're so excited that the University of San Francisco was inviting us to come and do this and at least begin the conversation for those of you that care. And so we've prepared the next slide, please. We've prepared the following agenda to tell you the story, really to tell you the story behind this urgent need. And hopefully we all see opportunities on how we can work together, no matter what field that you're in. This agenda, it appears in one way, may appear brief to you, but the topics are really quite deep and quite wide. And I really wanted to take a moment just to say that, because as Jean-Marc and I were planning and looking through this, we really wanted to give you so much information, but we knew that there's only so much time. And so what we really decided to do is do an overview of these topics at high level. And because they're all interconnected, and I hope that by the end of our time together today, you'll see how that is. And as you're looking through the agenda, we really want you to know that we've spent a considerable amount of time to really try and create a presentation that covers the highlights as simply as possible and hopefully as meaningful as possible to all of you. At this point, I'd like to go to the next slide and turn it over to my esteemed colleague, Jean-Marc. I'm so excited to work with him again and just have him give you a bit of insight on this whole culinary health and these whole connections. And so Jean-Marc, it's all yours.
Hello, thank you all for joining us. This project started when the pandemic crisis started. And we saw the devastating effect it had on restaurants, chefs, cooks, and also the terrible toll it took on people who had underlying disease. I mean, 70% of casualties were from people who had underlying disease. So Marlene and I talked together and said, maybe we should try a program, develop a program to train chefs on how to cook healthy foods and to bring value to their offering. Fast forward today, and we are in the middle of a much bigger crisis with the current pandemic of diet-related disease brought by the current food business and lifestyle. And we'll talk about this during this presentation, and you will understand. The word crisis in Chinese is spelled with two characters, one for danger and the other one for opportunity. The first eatery to be named restaurant was born after the French Revolution crisis, when chefs were out of work because their patron literally lost their head. And the chef took an opportunity to create a business where waiting staff and serve patrons choices of food from a menu, and he called his business restaurant. Restaurant from the Latin word to restore and renew your energy. That worked in a time where people are living in a very physical, demanding world to make a living. And this also marked the beginning of gastronomy, where people could actually go out, choose some foods, and enjoy food around a table. In today's world, restaurants need to be more than restoring your physical energy with the environment and the health crisis we are facing with. Restaurants need to be about restoring our health, the health of the environment, and our mental well-being. Okay, Marlene?
Yes, next slide, thank you. And so really as we begin this story together, and we're putting all the pieces together, our modern story really begins to unfold really into one of multiple interconnecting forces that are at play, which have truly created the perfect storm. On the next slide, what thought we'd start with is this really kind of the big picture perspective. So when you look at, just take a moment and think about when we really are looking at the deaths worldwide that are related to the top 4 chronic diseases that impact human lives. We're talking about the ones listed here on the screen. Hopefully you can see those very well. So whether it's cardiovascular or cancer or respiratory or diabetes, if you were to just stop for a moment and guess, and this is worldwide, if you had to guess, what percentage do you think are related to those four four chronic diseases put together, what percentage of lives have been lost to those? Give you a moment and we'll go to the next slide and give you a little insight. Unfortunately, the answer is quite bleak. These chronic diseases are collectively responsible for about 70% of all deaths worldwide. In fact, it's moving up to 71% the last I saw. So we're talking about 42 million lives. 42 million lives have been lost because of those four chronic diseases. And again, in terms of what we're able to share today, we're doing high level, we could get much deeper. We thought this gave you a pretty good idea of what we're talking about. So let's take a deeper look at what those causes are. So when we go to our next slide here, this is such an important part of our conversation today. And there's so much we want to say about it, but if you really look at the top four factors that determine our risk for developing chronic disease, or on a more positive note, perhaps protecting ourselves from it, we're talking about lifestyle. So it's the foods that we choose to include, or perhaps it's the foods that we're excluding from our plan. It's how active or inactive we are on a regular basis. It's whether we choose to use tobacco, or perhaps we're in situations where we're regularly being exposed to tobacco, or perhaps using alcohol excessively. So when you put all those factors together, they really are, they're actually considered preventable or modifiable. For those of you that on the line that are in the healthcare, you'll be very familiar with those terms. They're called that because we technically can take action to change them. I'm not saying it's easy, but we can take action to change them. There's a whole other set of factors, like family history, et cetera, that also are a part of that. But most importantly, and you might be surprised by this, but those factors, 80%, that's a big number, 80% of our chances for developing these diseases are actually related to those four things. So it just shows you how much control that you have. You know, in all the years that I've worked, you saw or heard some of the things that Mark and I have done together, and certainly in my own career, I've had the opportunity to counsel many patients, some one-on-one, some large groups, et cetera. And I can't tell you the number of times that you hear people say, well, it's in the family, right? My grandpap got it, or my mom, dad, whoever. Well, that's a part of it, but 80% of it are these risk factors. So very important. And we're going to stay on that slide for a little bit because there's some things that Jean-Marc and I certainly want to share with you. And so, I mean, of all of those, and this may surprise you, but of all of those, unhealthy eating is the number one. So if you had to rank those, they're in order for that reason. It really poses the greatest risk for developing these diseases that we're talking about, and certainly deaths, more than any other lifestyle factor there. So and you're going to see as we talk a little bit more how deep that goes. Science actually has shown us that, you know, when we talk about unhealthy eating, and that puts us at the greatest risk, what we're talking about, and we'll get into a lot of details as we move forward, but what we're really talking about collectively, when you put these things together, so it's a pattern. We're talking about, you know, high intakes of red meat and processed meats and prepackaged foods and things that are high in you know, sugars, added sugar, but also hidden sugars. We're talking about animal products that have been conventionally raised, high-fat dairy products, refined grains, and certainly high intakes of refined carbohydrates and sugars, fructose, corn syrup, all of that. When you put it all together, what you're really talking about is a very calorie dense, but unfortunately nutrient poor, right? It's very nutrient poor, and you know, supersized portions in many cases too, and not just in the United States. Unfortunately, this type of eating pattern is becoming, they call it a westernized eating pattern, and more places across the world globally are unfortunately taking these patterns on, so nothing to be proud of. Also really important to know, and you'll hear us refer to this word inflammation. Those of you that are already in healthcare are probably very familiar with that, but it's important for all of us to know it. This type of an eating pattern actually promotes something called inflammation, which is associated with these chronic conditions that we've been talking about, and many others, not just the ones that we have on the slide today. So that's important, and as we go deeper into this, I think you'll see that connection. Before we move any further, the other thing Jean-Marc and I wanted to talk about a bit, because it's so important, is just stopping and really starting to think about our food environment. You know, when we think about our food environment, it's that physical, that's that social surrounding. It's the things that influence us, right? So not maybe just in our own personal day to day, but in our communities, in our everywhere. You know, whether it's the schools that you go to, the workplace that you go to, the places that you choose to eat, where you grocery shop, all of it. And in the United States, and now again, many parts of the world, this so-called food environment makes it very challenging sometimes to choose healthy foods. And maybe think about for your own self, right? If no matter what your life is all about, particularly as we start moving back into some types of normal routine, right? You start getting back into rushing and running to convenience-based foods and less healthy foods. But this convenience and this affordability of unhealthy food, oftentimes it's luring customers to eating really nutritionally empty snacks, processed meals, and supersized portions. Also very intriguing. I know as I've been studying and learning more and more, and certainly many conversations that Jean-Marc and I have had, the research suggests that our brains are actually primed to crave these types of food. So, and we'll talk more about how that happens, but triggering like very deep craving feelings. And oftentimes they're not satisfied unless you go for those processed foods, right? So a lot of times, you know, if we had time to share with one another, like, what are the foods that you crave? Most of the time you're not going to say it's asparagus and salmon, right? It's probably something from a vending machine or right around the fast food corner, or maybe it's your favorite sweet treat at Starbucks or wherever you may go. So usually when we're craving, it's those types of things. And we'll talk about the science behind that here in a bit.
Yes,
So,
Nadine, I have a question for the audience.
Well, I didn't hear Jean-Marc, go ahead.
Yeah, I have a question for the audience. Do you want to eat 25%? Do you want to eat and feel full with only eating 25, do you want to eat and feel 25% full by eating what you are eating? Mm-hmm. Very easy. You turn off your screen. If you turn off your screen and you eat mindfully, you will eat much less and be much more satisfying. Interestingly, do you know what is the country that takes the most time to eat in the world? You'll be surprised, it's Japan. Even though they are so busy working all those long hours, they take time to eat. They take the longest time to eat, and they don't have much obesity problem there because they eat mindfully. And we have to reconnect with the food you eat.
That's so intriguing that, you know, there's the 25% there. If you want to eat 25% less and still feel full, how do you do that, right?
50%. You can actually eat 50% less and feel full if you actually focus on what you're eating and you eat mindfully.
So when you put all of this together, the low levels of physical activity, the type of eating pattern that I've been talking about, and you add some lack of sleep there, right? Maybe not sleeping well, certainly through this whole pandemic phase, I'm sure we have all stories of different worries and concerns and changes in our schedules and, you know, family things we have to take care of, plus normal life in general. You add all that together with way too much time spent in front of these digital devices. All of that put together creates a very inflammatory environment for our bodies, but also for our minds. There's a lot going on physiologically underneath it all. So many experts over the years, if you choose to study any of this or just out of your own interest or just reading, really call this food environment toxic. And the reason it's called that is because truly it's corroding our healthy lifestyles, right? It's promoting overweight, obesity, it's promoting something called metabolic risk factor, and which ultimately leads to this chronic disease and death. So let's go ahead on the next slide and take a look at what I mean when I say a metabolic risk factor. Because this is very, very important, and a lot of people might, I don't know if anyone who's joined us today, maybe if you've ever had any of these risk factors, or certainly most of us know people who have one or more of these. And this is important because, you know, as we talk about this increased consumption of high calorie, nutrient and poor foods with high levels of sugar and unhealthy fat, which is a saturated fat, and not enough activity, all of that begins, what's happening, your body is rebelling, honestly, it's rebelling. And what I mean by that, little by little, if those types of patterns are, you know, one or two, every once in a while, no. But if those types of patterns are done on a chronic basis, what's starting to happen is this dysfunction at the metabolic level. So your body, for example, when we say adiposity, what we're talking about is the accumulation of fat in the lower part around your abdominal area. That's very dangerous for health. Insulin resistant, what that means is when the cells in your muscles and your fat and your liver, they're not responding the right way anymore. They're not responding enough to the insulin, and so your body can't use the glucose for the food and the energy. Also, what happens is your blood glucose begins to get too high. Not quite yet to diabetes, but right on the verge, right? You're moving in that direction. And then finally, for many people, they have what's called, high levels of fat in the blood. So if you've ever had your blood work taken, for those of you who are not in the medical area, if we're talking about having a cholesterol profile or a lipid profile, or if a doctor tells you, your lipids are abnormal, what they're talking about is things like your lousy, the LDL, which is your lousy. I always say the LDL is your lousy, and that's very dangerous. Also, if there's too much fat in the blood, those are triglycerides. So all of these things, isn't that interesting that those 4 lifestyle factors that we talked about earlier, when we're choosing more in the negative than the positive, they're leading to these types of things. Jean-Marc and I wanted to share with you a couple things is that, when you put all this together, I think there's no surprise, most of you probably are very much aware that there truly is a body weight crisis, an obesity crisis, not just in the United States, but many, many places across the world. If we had more time, I'd show you slides globally. One of the past companies I worked for, actually for the last 14 years of my life, have been global companies. And so we always took a very deep look at what type of obesity patterns were occurring in all the countries, and certainly beyond the United States. And so what we're finding is almost 40%, 39% of adults worldwide are overweight as of 2020. And those numbers keep going in the wrong direction. The other thing that's very scary, I think, also is children. We're seeing an obesity crisis in our children. It's different amongst the different countries, but it's happening. So not good. That's all leading to that inflammation that we keep talking about. And then finally, the point I want to make is that when an individual gets more than one of those things on the slide, so okay, they're starting to get overweight, and then their blood pressure goes high, and then their body is not using insulin in the right way. If you have 3 or more of those risk factors, it's something called metabolic syndrome. And it's not good because that is the path. It increases your risk to actually getting type 2 diabetes, and certainly cardiovascular disease. In fact, a lot of people don't know that, but someone who has 3 or more, there's a specific definition, but in general, 3 or more of those risk factors, for your risk for diabetes, type 2, that is 5-fold, and for cardiovascular disease, 3-fold. So you can see the danger that puts us in, and our food choices are so much related to those things on the screen right there. Jean-Marc, too, we wanted to have a moment to talk about fatty liver disease, just so I can give people a quick insight in case you don't know what that is. Basically, excess sugar and alcohol damage the liver. You may not know that, but excess amounts of sugar act very much like the way alcohol does to the liver, and it damages it. It's working at the mitochondrial level, and it's causing the liver to increase fat storage. And that's not good. And so this is how sugar causes liver disease, and it's just as addictive as alcohol is. And a lot of people don't know that. In fact, pediatricians who help the little ones, they already have seen this fatty liver disease in children. You can believe it, right? And so when we start to make all these connections, you can really see the detriments of this type of a style. And Jean-Marc, did you want to say a little more about fatty liver disease?
Yeah, well, once your liver, fatty liver disease is like having cirrhosis of the liver. Usually it's people who drink lots of alcohol, but when you eat fructose, it acts like alcohol. The only difference is you're not getting drunk, and your liver is getting sick, and it cannot process insulin very well, and then it stores everything into fat, and you get bigger and bigger. There is a new term that Dr. Lutzig just floated. He's got a book called Metabolic, and he calls it foie gras. And actually, humans are developing foie gras. Interestingly, foie gras was banned in the city in Chicago, in New York, in California, because it is inhumane for animals. And yet we let people stop themselves and getting sick like this. It doesn't make any sense.
Mm-hmm. Mm-hmm. Yeah, it's really not good. So when we go to the next slide, what we thought we would do, just quickly show you the trends. So you put all this together. And this is important because in spite of all the incredible advances in medicine, there's so much wonderful technology and so many advances that have been made over the past 2 decades. What trends are we seeing? And Cynthia, if you don't mind, this is just a toggle, so you'll go through the first one, just hit the first slide. And what I'm showing you here on the slide is really just showing you comparing year over year, comparing 2000 to 2019. So you can see the change in cardiovascular disease. The next slide, you'll see the same trend for cancer, respiratory, and then diabetes. So in every single case, the trend is going in the wrong direction. And tragically, we're losing too many lives because of the things that we're talking about on here. And there's also another staggering fact that Jean-Marc and I were talking about. And so if you were to put cardiovascular disease and cancer, you combine those, that has killed more people than COVID-19 as of 2020.
Yeah, 3 times
That's
more.
pretty shocking, right? I think it's pretty shocking when you think of it in that way. If we go to the next slide, we want to just give you a quick glimpse. There's so much more we could share about this topic, but just a quick glimpse in terms of the cost of chronic disease. Not only, this one is a USA-based one. It still gives you a glimpse. Globally, it's harder to get this level of data. I can personally tell you that, working in companies with global people or global locations all over the world, their data is collected very differently, but this still gives us great insight. And what you're seeing there are soaring cost of healthcare, which unfortunately, they're focusing, those costs are mostly because we're treating the disease, right? They're about the medications, they're about going to the doctor's visits. They're, for some people that get very down and get depressed because all this is going on in their lives. So it's for mental therapy as well. So all of those things. So those economic costs are more about treating versus curing the disease. And that's really important. Also, I think important to share that with you a little bit is if you just look in the United States alone, and this is, Jean-Marc, this is a great figure, that data from the Center for Disease Control, when we compare the obesity rates over time. So let's just say in the year of 1990, so 12% of the population was obese. Fast forward to 2021, we are now at 42.4%. 42.4% of our population meets that definition. This is the first time the national rate has passed the 40% mark. And unfortunately, it continues to go in the wrong direction. Just further evidence of this obesity crisis and a much deeper health trend. And then finally, if we compare that to 2008, the obesity rate has increased by 26% and keeps rising. So it's not going away, right? It's not going away. When we go to the next slide, just a little bit more about cost from a whole different perspective. This one's more about the cost of processed foods on our society. So some interesting figures on that slide. What we really want to share is that unless we begin to make lifestyle changes, healthy lifestyle changes, the food industry, and plus, this is and a plus, the food industry changes the way that food is prepared and marketed to all of us, the number of people with chronic diseases and the cost to treat them is just going to continue to rise. There's no end in sight unless we begin to make some changes there. As you saw, lots happening in the medical world, but it's more about treating and not curing, right? And then on top of that, if you add, an aging population to all those challenges, both the prevalence and the severity of this disease will increase. This slide is from Dr. Robert Lustig, who's a very well-known pediatrician who's also very known for all the work that he has done in terms of talking about our very processed food world that we live in and the many detriments to our body. One of the things that he has surmised through all of this is that this trend that I'm showing you is not sustainable. And he estimated that Medicare will be broke by the year of 2026. And Jean-Marc and I were talking a little bit earlier, and also Social Security. So it's not sustainable. We can't keep going in this direction. And then finally, one more point, just kind of behind the scenes, in case you're wanting to know, is if you were to project further to the year of 2030, what they're predicting is that 83 million people in the United States will have 3 or more of those chronic diseases. Isn't that scary? 3 or more. So imagine if you applied that to the worldwide population. So how do we look at that to kind of summarize this? Is that it's the healthy changes in our lifestyle, especially the way that we eat, that could prevent many of the things that I'm showing to you, not only from a disease perspective, but also from a cost perspective. And it would improve our quality of life for sure. I mean, I would imagine if we could survey everybody on the line with us today, you probably know more than 1 or 2 people that fall into these categories that we're talking about, right? That are trying to manage all these. And we also would certainly reduce the need for all these expensive treatments. So what are we saying? Moving away from this unhealthy, supersized, high-calorie processed plate to a more nutrient-dense one is critical to this epidemic that we're seeing. Moving away from a physically inactive style, too much time in front of our screens, to a more active one, and certainly moving away from, many of you might be familiar with mindless eating. Do you ever I don't know if any of you, and if you think about it for a moment, we all probably have done it. I know I've done it sometimes and I catch myself, you're in a hurry, or you're just, feeling unhappy about something, or maybe happy about something. And before you know it, you've ripped through the whole entire bag of whatever the goodie was that you chose, right? Or maybe it was healthy food, but you didn't really take the time to stop and enjoy it. And before you know it, you've had huge portions. So all of that matters. All right, let's go to the next slide. We're making pretty good time, but we'll make sure we get in the main points here for all of you. So how do we connect this? Without a doubt, the interaction of COVID-19 with this global rise in chronic illness and these risk factors that I've been sharing with you, they are connected without a doubt. And the research has shown us that those people with pre-existing chronic conditions, these things that I've been telling you about, were more at risk for these COVID-19 complications and hospitalizations and death. In fact, if you go to the next slide, Cynthia, if you don't mind, is when we compare what this slide shows you, it's meant to really show you patients. So all the patients is on the first bar chart, but if you go to the middle one, this is showing you those patients with no underlying conditions, and then what happened in terms of their hospitalizations and death as we move forward. So, excuse me. And when you compare that with those who had underlying conditions, you can see the story is strikingly clear, don't you think? And this data, imagine this chart was done on 1,300,000 and some individuals in laboratory confirmed cases, and that was May of 2020. So add in all the ones that have occurred since then, right? So we began to discover that this was going on. So the story is very clear. So really the message there is how fit we are, or how fit we are not, really determines our survival when something so infectious like COVID-19 attacks our world, and who knows what's to come. We hope nothing more like that ever happens to any of us, but you don't know. So we got to stay fit. We have to stay fit. So this brings us to the next very exciting topic on the next slide, which is really important. Like, how does this all connect to our immune system? I know that's a lovely picture. Right before either you're getting ready to eat, or maybe you've already had your dinner, depending, or breakfast, depending on where you are in the world. But this is important because research has clearly shown that our immune system plays a very key role in the chronic disease process. And in fact, it's been relatively a new discovery over the past decade. They consider it a very pivotal advance in the biomedical research. And even myself, when I started to dig into this topic more, I was very surprised to see some of the things I want to share with you. And one of those is that if they're all throughout our body. There's many things that are happening from an immune system perspective, but 75% of that is happening in your gut. And if you're not in the medical world, you're not quite sure what I mean by gut, really what that is, your gut is your, or intestinal system is a group of organs. So it's your mouth, it's your esophagus, your stomach, your pancreas, your liver, your small intestines, your large intestines, and even the rectum. So you put all that together, that's what we're calling the gut. And throughout there's many different things. There's different cells that function as part of the immune system, but particularly in your small, and especially in your colon or your large intestine, there's this whole colony of microbes. Really, they're bacteria that are living in there, and there's 300 to 500 different types of bacteria. And they all have different genes inside. So it's a little bit complicated, but to know that that's going on inside of your gut, it's a good thing. And I'll tell you why. But when you pair those up with the other little organisms like viruses and fungi, you put all that together, if you've ever heard through reading or just out of your own interest, microbiome or microbiota, that's what they're talking about. They're talking about all of those bacteria and the other components that I mentioned to you. And they're specifically in the large intestine and some in the small. And the important part of all this, to what the topic is that we're talking about today, is if that microbiome is healthy, it helps to promote your health. And if it's healthy, it helps to promote a healthy immune system. So it's very, very important. So it makes complete sense if we're talking about the gut, that the food that we put into our bodies is going to influence our gut. And so do other lifestyle factors. But on the next slide, if you don't mind, I'm turning to the next one. This is important too. This is relatively new information, and it does definitely connect to what we're talking about. If you've ever, it's really called the gut and brain connection. So if you stop for a moment and think about this, have you ever had a gut feeling or butterflies in your stomach? I'm sure all of us have felt that. Actually, those sensations that are coming from your belly, it suggests that your brain and your gut are connected and that they're working together, and it's true. Actually, hidden inside the wall, the digestive tract, it's the brain, it's in your gut. And medicine is really starting to understand that there's a very significant link between our digestion, our mood, our health, and even the way that we think. So, if you're having, your gut's not happy and you're in a bad mood and you're feeling all these different other things, it's all interconnected. And many people don't know that. Also very important, the scientists call that little brain the enteric nervous system, but it's not so tiny, just so you know. There's actually made up of two thin layers of more than 100 million nerves going up and down your GI tract, all the way from your esophagus to the rectum. So very important. The research definitely shows that our brain affects the gut health and your gut health affects your brain. So what's the food connection to that? Well, here it is. And so those microbes that I just told you about that live in your gut, they actually make certain chemicals that affect your brain. So if they're not healthy, the brain's not going to be in good shape either. So it's really important. So the foods that we choose, they either are going to increase the good bacteria and improve your brain health, or they're going to decrease the bacteria and decrease your brain health. So very important to understand that connection. And as Jean-Marc and I talk about cravings and all those things in here in a little bit. All right, let's go to the next slide if you don't mind. So this slide really is one to just spend a moment or two on, because it's very important. It's actually very amazing that within 24 hours or one day, that if you think about all the foods that you might eat over a 24-hour time period, they actually do change the balance of your gut bacteria. So creating either a healthy anti-inflammatory so in our gut, or an unhealthy one. So the foods that we choose actually have the power to change that within a 24-hour time period. And so that's very important. And as we talk a little bit more about a good eating style and a not so good eating style, I think you'll see that connection. So let's go to the next slide then. I think this is a great place to take a look at the Western eating style. I think you've already started putting together, based on what Jean-Marc and I have been sharing with you so far, that the typical Western eating style, which again is becoming more global, very high in processed food. Depending on what resource that you look at, it's over 60% coming from processed type foods, ultra processed foods, animal foods, 25%, and then the rest, sadly, is like just a little bit from the whole plant foods and then some from processed plant foods. So you can just see from that little pie chart, not so great. Really important to this topic is that when you look at your healthy gut, it's really important to have a very diverse diet. And also, if you have a diverse diet, then that microbiome that I was telling you about, it'll be diverse, and that's what you want. Unfortunately, this typical Western eating style, with everything that we've just talked about that's involved in it, it makes your gut bacteria less diverse. And that's what leads to the immunity problem. And that's what leads to the chronic inflammation and puts you more at risk for chronic disease. And Jean-Marc, I know we're going to talk a little bit here about the Dr. Lustig and the processed foods. Like when you look in the grocery store, and if you looked at over 600,000 items in the grocery store, what are we finding, right?
So we have 77% of food items that contain sugar. And a lot of sugar is actually hidden. You don't see it. Sometimes they use different names, fructose or some other names. But you have sugar in salad dressing, you have sugar in pasta sauce, in in all kind of food, and on purpose. It's purposely put there because sugar is addictive, and all the food company know that, and they put it in because once you start to eat sugar, you will become hungry. So there is a very vicious cycle. Sugar will make you hungry. The refined carbs that follows that will make you fat, and then the processed and damaged oil will make you sick. And the damaged oil is, we're going to talk about a little bit later, is once you manipulate an oil, you actually either heat it, you take chemicals to extract the oil is damaged, and therefore you create a free radical, and free radical are actually inflammatory, and they are oxidizing your cell. This is why you hear this word antioxidant. And then once you eat this, you really get sick, and it's just everywhere.
Mhm. So when we talk about that and we go to the next slide, we're showing you two more things that we think are really important for everyone to understand. So if you've ever heard of something called insulin resistance, if you haven't, it's important. And so this little chart on your slide is meant to show you that. But so when we eat a Western eating style, it really promotes this condition called insulin resistance. Plus, it also creates this feeling of not feeling satisfied after you've eaten. Hungry and you keep going back, hungry and keep going back. And so what's going on? And so really, normally, insulin is a hormone that helps the body absorb glucose. So no matter what you eat, when it's eventually broken down into glucose, the insulin takes it to where it needs to go and it keeps your blood sugar levels balanced, right? That's good. That's a good thing. But when we're eating these foods that are very high in sugar content, what's going on, highly processed foods as well, it overloads the body's ability. It's too much for the body. And so the body's overloaded and to produce enough insulin. So as a result of it, it limits the ability of the cell to absorb it. And if the cells become too saturated with too much blood sugar or glucose, what happens is they respond less and less to insulin. So that's what insulin resistance is, right? That's what's going on. It makes it harder for the body to do its job, to take in glucose. And when too much glucose is staying in your blood and not being taken to your cells and the various places that need them, what's going on with that is it's making your blood sugar stay too high in the bloodstream, and that's dangerous. It does many things, one of which is it damages your kidneys. It causes something called neuropathy, which is nerve damage. It's really a vicious cycle. And you still feel hungry, right? You're doing all that and you still feel hungry. So it's not a good thing. And the good news is, this is the good news, is that certain nutrition strategies actually can improve that and also make you feel fuller, happier, satisfied, right? Because of time, and we're doing good, but I'm going to keep moving so we can get to some of the good stuff here as well. On the next slide. Now, Jean-Marc, we'll look, we've got plenty of time, just being conscious of it. When we look at this slide, we're reflecting really all the components. I think you've kind of picked this up as I've been talking and Jean-Marc have been talking. All of these nutrients or lack thereof, these food categories that are on this slide make up what a typical Western eating style is, in the effort of keeping it general as possible. And also because of the length of time that we have to spend together today. What we thought we would do is just highlight some of the reasons why these things aren't good, right? I think you kind of have put together so far that with the things that most people are consuming, you haven't heard me talk much about eating fruits or vegetables and whole grains, have you? on the processed eating styles, so we're lacking those. So on this slide, Jean-Marc, just talking through a little bit, if you want to talk a little bit more about red meat, we certainly know that in a Western eating style that in general, it's too much red meats and the foods, too high fat dairy foods or things that are coming from animals. So it doesn't mean you can never have them. It just means that what Americans and other countries, populations are doing, too much of our diet is too high in it. And certainly the processed meats. Jean-Marc, you want to say a few words about the processed meats?
Well, the processed meat, yeah, especially when they use a lot of preservative, they use nitrates, and preservative. And unfortunately, those preservative, they go back into your guts and they destroy all the microbiome there. So it's not great. They are very high in sodium and really, really high, which is also very unhealthy. and I say they contain a little amount of sodium and preservative. And then you also have all the fats, and especially if you look the bottom page, everything is deep fry in oil. And once we talked about the oil and how it gets damaged, once you heat oil to a certain degree, high heat, and if this oil has been processed and is polyunsaturated fat, then it becomes toxic. So you're eating all those empty calories, those starches that are quickly processed into sugar and they are frying bad oil. So it's like really bad, bad diet. Yeah.
Yeah. And Jamal, I didn't hear, I don't think you said, we wanted to make sure to share with everybody. It's so interesting is that because all these processed oils are, they're in a lot of foods that you don't even realize they're in there, right? When you're grabbing your things that are in a package and they're already prepared and ready to go, the manufacturers put these high omega-3 processed oils in your packaging and things. And so when you look at that ratio of the omega-6 to the omega-3s, it's a very unhealthy balance right now.
Unhealthy. Yeah, and so basically, a lot of oil that is used commercially come from seeds and grains and seeds. And in order to extract the oil, the seeds are processed with chemical. They actually use solvent to break the seeds. They use bleach to clean the oil. They heat the oil to a high temperature, and you have hydrogen molecule that goes in there. And at the end, the oil is completely damaged, and it actually makes you sick. And those oil, for most of them, are polyunsaturated oil. And polyunsaturated oil contain omega-6. Omega-6 is what makes your blood thick, which we need to have in small dose. It creates inflammation, which we also need, right? If you get a little fever, you need this. If you have a strain, you will swell because it's, so this comes from inflammatory and from omega-6. But too much of it is actually really toxic, and we eat way too much. And then you have omega-3. Everybody heard about omega-3? Omega-3 is the good oil. It's in monounsaturated fat, right? And omega-3 actually is anti-inflammatory. And you should have, ideally, in an ideal world, you should have 1 part omega-6, 1 part omega-3, right? It could be 1 to 4 at the max. In our current diet, it's 1 to 27. So we eat way too much polyunsaturated fat, way too much omega-6, and it just creates this inflammation rush and whatever that's present in all those processed foods.
That's right. And all of that, all of what Jean-Marc shared to you, that's all leading to, it's actually been shown, the research shows it, that this imbalance is one of the key things that is due to the increased amount of chronic and inflammatory diseases, right? It leads to creating plaques, clogging up your arteries, all of this. So that, and then you add the refined grains and the extra sugar, and there you go. Mm-hmm. So anything else for you, Jean-Marc, on that slide? I was going to move to the next.
You can move to the next slide.
You good?
Yep.
Okay. So now we get to the beautiful stuff, the vibrant colors. So earlier we mentioned that how diverse your diet is ends up determining how diverse your gut microbiomes are. It goes hand in hand. So we learned that the processed food eating style, you get low diet diversity of your bacteria, and you get all those problems that we just talked about. Well, the good news is that the eating plan, we're kind of avoiding the whole diet things because it's really more about an eating style, right? It's switching over. Even if you decide I'm going to do this little by little, or some people jump right into it, it really depends on what your goals are, or maybe you're already doing it and looking to refine it even more. So a fiber-rich eating style, really things like what's listed on this screen. So whether they're the beans, the legumes, the fruits, the veggies, the whole grains, they provide a very diverse amount of nutrients, and that leads to a diverse amount of bacteria. And why is that important? Is because it supports a healthy microbiome balance. And this gets back to reducing that inflammation that we're talking about and enhancing our immune system. So, certainly during COVID, if you were listening or trying to pay attention to anything that they said, well, what can we do personally to protect our immune system? If you were reading any of those things or searching it out on your own, what you should have been seeing are things like this that we're talking about, right? More fruits, more vegetables, more whole grains, getting away from these processed foods. So basically our guts are happy and support a strong immune system when we have plant foods that are high in fiber, right? And we'll talk a little bit more about this as we move on. So you really want to start thinking real food, minimally processed. This is what's going to protect my immune system. It's going to protect my gut. It's going to protect my health and help me to be more resilient, right? Resilient in so many different kinds of ways. On the next screen, we're going to go into a little bit more detail, I think, on this screen about the different types of the grains. So thank you. So you see a beautiful slide here. Let me go here for a moment. Depending on our time, I might go back to this screen. I'm just being sensitive of everyone's time, so we have time for questions. So let's look at here. So really the foods that we're going to be talking about. Actually, Jean-Marc, yeah, I apologize. Let's go back one more. I think we'll have time to do that. I think it's important because it leads up to this slide. I want to go a little bit more, Jean-Marc, into the whys behind those, right? What are those nutrients that are in these foods that matter? So we'll take a little bit of time to do that. So when we talk about beans and peas and legumes and lentils, which are known as legumes, let's say a few things about those. We know that those are great sources of fiber and protein.
I think pretty much it's really simple. In order to eat healthy, you have to remove the sugar, increase the fiber, don't use those bad oil, right? So if you look at here and keep food naturally. Don't try to process the food. Don't try to ground it and mash it, because once you ground the food and you process it, your body burns it like sugar, and it gives you this insulin rush. So in here you have whole, real food. You have beans, legumes, right, which are ideal because they provide protein, which also slows down the way you process sugar, and they are very high in fiber, and they are very low in carbon footprint. So they are probably one of the best foods. So we should really start to learn how to add beans and legumes. Then you have, look at all those colors in there. You have all those vegetables that are very high in fiber, and they're also very high in phytochemicals. Phytochemicals means phyto is Greek for vegetables, and those are special chemicals that are in vegetables, and it changes with the color. So you want to eat a lot of different color vegetables to get all those different phytochemicals. And they are very good at fighting cancer and also at slowing inflammation, especially those berries. And we talked about inflammation before, so they are very key to eat. We have fruits, and then we have the nuts and seeds and the whole grain, which, because they are whole and because they are not broken. So basically, if you take fiber, there is two types of fiber. There is the liquid fiber, and then there is the hard fiber, which is kind of like a cellulose. So the cellulose, when you eat fiber, it goes into your stomach. If you drink water, it will swell up, it will make you full. And the combination of the two fibers together act as a filter and really slows down the way you process sugar. So it's very important to eat whole food with plenty of fiber.
So excellent point, Jean-Marc. And over and beyond all of that, also many of those food categories will provide you a host of phytochemicals and different vitamins and minerals that you cannot get when foods are too processed, right? So the more whole we can leave them, the better in terms of your nutrients. Now, when we go to the next slide, just a few points we want to make sure that you guys have while you're with us today. So all of these foods and nutrients that promote your gut health, those are also boosting your immune system. We talked about fruits and vegetables having, they have something natural in them that are called phytochemicals. They're disease-fighting nutrients. So another way to look at it, the more color that you see a fruit and vegetable have, the more phytochemicals that are in it. And if we don't have time today, but if we were able to show you that different colors provide different phytochemicals and antioxidants, it's so intriguing to know that. So that's important. But those same fruits and vegetables also have different types of fiber. And this is what's important about this. There's a soluble fiber, and then there's an insoluble fiber. They both have a role for the health of your gut. And so the soluble fibers, they are actually feeding the microbial community in your colon. And that's what gives it the balance. And then the insoluble fibers, what they're helping to do is to process it and eliminate it, get rid of it, right? So both of those are very important. When people don't have enough fiber in their diet, through these various things, it leads to a very big imbalance and poor gut health. So that's important. And what a lot of people may not realize too is that these high fiber foods, the ones that are not broken down when they get into your digestive tract, into the large intestine, that's good in a way because what they're doing is they're fermenting. That probably sounds not so nice, right? But they're actually fermenting inside the gut. And that's good because it's known as a prebiotic. So it's actual prebiotic fiber. It's naturally found in foods. And again, those are coming from things like beans and peas and legumes, certain fruits, certain vegetables. Those are your best sources of the prebiotic fiber. So when your gut is fermenting those, it's making all these beneficial compounds that provide energy to the lining of the cells. So a lot more I could share, but just at a high level. And then finally, this other fiber, there's something called a probiotic fiber that's not found in food. So we're not talking about the probiotics that you buy in a pill and swallow, right? We're talking about foods that contain this naturally, and they also help to maintain and restore a healthy gut. So those might be things like sauerkraut, certain kinds of yogurts, kefir, kimchi, tempeh, miso, all of those provide like more probiotic bacteria. And so a nice balance of those with all these other foods can help create a healthy gut. And so really, if someone had a question regarding probiotic supplements, should you take them? Really, those are meant for you and your doctor to decide. You really shouldn't be buying those on your own and consuming those. And over the years, and so many of the patients that I've helped, when they've had problems with their gut health, they're popping these probiotic supplements, but guess what? The foods that they're consuming are totally the problem, right? And so when we are able to help them to transition to a healthier way of eating, they don't need that probiotic. A lot of times it wasn't working anyways because it didn't have the right environment. So it needs to come from the food. All right, so as we move forward, we wanted to talk a bit about how do you put this all together, right? So on the next slide, so what's next in how you personalize the information, whether it's for yourself, whether it's for your clients, or perhaps you're a food service operation, whatever reason that you're on the line with us today, maybe it's for you and your family. One of the keys here is how you begin to design your plate. So here you can be creative and artistic as you like. There are certainly some guidelines associated with that. This particular diagram really shows you, you may not look like a typical process plate, does it? So when you think about the beginning of the presentation that we had, more than 50% is actually 63% of the plate was made up of processed foods, right? And what do you see on this plate? When you really begin to look at that and see more than half of it, pardon me, is made up of wonderful, colorful vegetables and some fruits. And about a fourth of it is made up from things from whole grains, and another fourth of it from your protein choices, and certainly balancing the type of healthy oils that we're picking. And always water. I think we didn't get to talk much about water, but I want to mention it because as you move more towards this type of an eating style, water is important for health, right? 60-some% of our body is made up of water, but particularly as you transition to a more healthful eating style, increasing the water is important for your gut. You can probably imagine why, right? So if you're getting all these wonderful natural fibers, the body needs some water to help it do its job, and let alone all the other wonderful functions of water. So again, at a high level, this is what we're talking about in terms of the healthy plate. And Jean-Marc, I don't know if you want to spend a little bit more time on this or go more into some of the points that you had on your next slide.
This is a very interesting slide, important slide, because it's like how you redesign a healthy plate. So if you look in a normal plate, right, on the left, that would be all protein, mostly poorly raised protein, full of antibiotic. It would be a 10-ounce steak, maybe, or a high amount of meat. And then it would be on the left side, it would be the carbs, will be all refined carbs, French fries, etc. And then you have a little vegetables. In here, we would have first 50% of the plate should be vegetables, nice vegetables, full of fiber and water content, not too much starch. And then you would have the carbs, and the carbs would be, so instead of like doing fried potatoes, right, you could actually do fried sweet potatoes, which is actually higher in fiber and vitamins than potatoes. You could have, you could use some healthy grains instead of white rice. You can actually even choose grain that are with resistant starch. Those are like black rice, brown rice, or actually, interestingly, if you cook rice with coconut oil, the way you manipulate the starches, it become a starch resistant. A resistant starch is when you only consume 50 to 60% of the calorie, and all the rest goes back into your gut and actually feed your gut level. Um, you could use for the bread, right? Instead of using white bread, use whole wheat bread, and even better, use maybe some sourdough bread. If you take sourdough bread, you take care of a lot of things, especially whole wheat sourdough bread. The way the yeast, the sourdough yeast, actually eats the gluten, so you get rid of some of the gluten. It actually also process the whole grain, so then the whole grain release all their nutrient. Whole grains sometimes are bind together, and they have what's called an anti-nutrient, when not all the nutrients are released. So if you use sourdough, it actually breaks down this little acid and binds all those minerals together, magnesium and those things, and you get much more whole grain. And then it's both pre and probiotic. That means the yeast actually it's like yogurt of kimchi, so it feeds your guts and it slows down the absorption of the sugar and you feed your gut. So this is the beauty of sourdough bread. And then you could use, whole wheat pasta. They also have all kind of pasta with lentils and for the whole grain, use quinoa, which would be really one of the best grain because it's high in protein and fiber. And then for the protein, use a healthy protein. You don't need to eat 10 ounces of protein. If you have 4 ounces of protein, it's actually plenty. And then use a healthy protein. And if you can, use a vegetable protein, right? Use the beans and create your own protein. If you mix beans and brown rice, or if you mix lentil and whole wheat bread or quinoa, you actually create a protein. You get all those 9 amino acids, and it's done in a lot of culture, and it's actually very satisfying. Yeah.
Excellent. Thanks, Jean-Marc. And so just to pull that all together on the next slide, really this way of eating that we're talking to you about, this whole food plant-based eating style, really there's a very wide, what I call a culinary umbrella. So you can create it the way you want to. If you understand the components that it's made up of. You certainly want to have a balance, right? You don't want to eliminate any of these major food groups, but there's so many things to try. And if you're someone who really hasn't gone down that pathway, when you begin to experiment with it, you'll be, I think, very, very surprised how full and satisfied that you feel. And some of these symptoms that maybe with your gut that weren't so great, or mood, and some of these things will improve naturally. And depending on what's going on with your health, you may choose to work with a registered dietitian to help you to customize it more for yourself. But you can certainly get started on your own if you're doing this for yourself. And if you're more in the culinary and food service area, these are things where we give you the concepts today, but there's a lot more kind of exciting things to show you how to cook to make it taste healthfully, and how to balance your good fats and all of those types of things. So
yeah, you also want to use the right cooking methods. So stay away from frying, especially if you have all those bad oil that are used for frying. And then use steaming, use oven roasting, use grilling that really preserve all the vitamins and nutrients of food. Sometimes if you fry, all the fat soluble vitamins are also lost in the oil. If you boil too much food, it gets lost in the water. So you have to apply the right cooking technique to preserve all those nutrients. And it's not that difficult. I mean, even with potato, right? Let's say you want to take a potato, you can make a mashed potato, and instead of loading it with butter or anything like this, you can just use a nice mashed potato with olive oil, and it's actually really delicious and good for you.
Well, I just want to interject for 1 second. We have about 20 minutes left in general with our time. We are getting so many good, wonderful questions.
Oh, good.
That's good. So more to come on that, but I thought I would just give you guys an update.
Excellent. All right, that's perfect. That's a good monitor there. So that's perfect timing. We're ready for our next slide. And really to wrap up this portion of our food conversation, I think this is such great research. And so, really when you think about it, can you retrain, your taste buds? Can you learn to like more real foods, truly crave the real food that we're talking about and not crave these less refined foods? And the answer is yes. It's actually quite intriguing that when you look at the cells of your taste buds, they turn over. So new taste buds come about every 10 days. There's a range there, but just in general to give you that point. And so as you move away from these processed foods and start eating more of these whole grains and these less minimally processed fruits, vegetables, grains, all the things that we're talking about, you actually can begin to train your taste buds to prefer that. Not only you're going to feel more satisfied, but looking forward to eating it too. Now, of course, we need to bring in the fact that certainly we need to consider the food environment that we talked about early on, right? So all these things that are tempting us and our food culture and the way that we were raised and the places that we go. So that certainly is a component of that part of it. And Jean-Marc, you had a story that you were sharing with me is years ago, actually Jean-Marc and I both used to work with the Dr. Dean Ornish program. And so some of those experiences brought us into different hospitals to train food service teams and chefs. But Jean-Marc, you were, this was before my time. I was not with you on this one, but you had mentioned you had a story.
So the problem with processed food in the food industry also, we are pretty much brainwashed since childhood, right? We have all the cafeteria in schools and in university that sells all the soda, all this food with sugar, and then basically gets student hooked on this. Processed food has a term, it's called the bliss point. Bliss point is when you mix salt, sugar, and fat together, and you have it at such a high level, then it's completely addictive. And this is when they really have a winning product. And our palate is kind of like overstimulated with all this additive and food. I mean, they can even make taste truffle or cheese that is completely artificial. So our palate are overstimulated with this food, and we need to retrain our palate. I see this with our students. Once they eat actually real food, they're really surprised how good it tastes. So that's, and I wish we need to change our culture in the way we approach food.
More opportunities to show people that. So those sense of cravings can change in your taste buds. So, right. So let's move forward in respect of time. We definitely wanted to talk a bit about on the next slide. We wanted to talk about the connection between our food that we eat and the environmental impact. And so really the same type of eating style that's destroying our health, unfortunately, is making a negative impact. It's destroying our planet. And when we really look at the food systems that are necessary to get to the foods that are brought to us to consume, what research has clearly shown is that it's harming human health and also threatening our environmental sustainability. And so, Jean-Marc, we had multiple points to share, and so we might condense some of those just in the respective time. But I'm going to turn that over to you because I think some of this slide is really a great slide, which comes from a group that has done many of them, and this particular one is really showing carbon emissions of all the way from beef all the way down to more plant-based. And I think you can quickly see what the message is on that slide is that the more animal-based foods that we're consuming, the more negative impact it has on the carbon footprint. It's very clear.
Yeah, that's right. So 80% of global agricultural land is used to raise livestock. 67% of crop is pretty much made to use corn and soy to feed this livestock. And there is a problem the way we grow this food, especially for the environment. When we grow this food, it used to be we had little farm that would raise cattle and they would take the cattle and feed them the straw and put it back into the earth as fertilizer. Now all the fertilizers are synthetic. So we have synthetic fertilizer, synthetic herbicides, synthetic pesticides. And what we do is we pretty much kill all the topsoil, all the life that is in the topsoil, the first layer of dirt. There is a lot of fungus and little roots and little plant in there that actually absorb the water. So when it rains, those plants act like as a sponge and they absorb the water. Once those plants are killed, the water cannot be absorbed. It doesn't feed the aquifer to reserve water, and it runs off into the stream. And when it runs off into the stream, it carries all those nutrients, all those synthetic pesticide and herb and fertilizer goes into the stream. Those things goes into the ocean, and then you have all those dead zone because this fertilizer promote those algae, those toxic algae that pretty much kills everything. So that's to start with. So if you look at this, beef is pretty much the worst for that, the way we raise them. The only good thing about beef, interestingly, if you take beef and you feed them grass, grass are like omega-3, and actually you don't have, grass-fed beef is much healthier for you to eat. And the same thing with the milk and the dairy and the butter from those cow. I can give you an example. It's very interesting. And I actually saw this in my kitchen when I took some grass-fed butter and I used regular butter. And I forgot them in the back of my fridge one time and I picked them back up. And the, the regular butter was rancid a month later. The grass-fed butter was still completely fine because of the omega-3 that's act as an antioxidant and protect the butter. And it does the same thing into your body. So if you do eat beef, try to eat grass-fed beef. And also it's the way they raise those animals in those food factory that are just horrible. Cow stomach are not designed to eat corn and grains. It makes them sick. So what they have to do then, the cow gets sick, they feed them corn, they get liver disease, just like we talked about it. They get very fat very quickly, but then they get sick and then they have to feed them antibiotic. So at the end, so they don't die. So at the end, we're eating a sick cow then making us sick, right? It's a very vicious circle. And worst of it is when we eat this meat with all those antibiotic, hormones in it, all those things, it actually goes into our guts, and that antibiotic kills the good bacteria in our guts and also promotes some antibiotic resistant bacteria. That is a big problem. I can give you an example. For example, if you go to Argentina, in Argentina, they eat 2 times more beef than in America, twice. And they have almost half the heart disease than we have in this country because their cow are fed with grass. So that's just to tell you how good it is. So
No, what a
grass-fed butter
difference.
is great. And then if you look at the rest, right, you have the cheese. Again, it depends what kind of grass is fed to the cow to the quality of the cheese. And then we have prawns. Prawns, it depends how they are farmed. Sometimes they are farmed poorly, and you have to destroy all this mangrove that where all the baby fish are grown. And also it depends, some country feeds their prawns food that is absolutely horrible. So you have to be careful where you have to look at food and see where it does it come from. If and what was fed to your food and you're eating. Especially when it comes to from Asia and China. Some of the food is full of chemical and things like this, and you won't want to have. And if you look way down, you see the best food at the end is vegetables. So vegetables is the best thing. It's good for the environment and it's actually good for you.
Great points, Jean-Marc. And as we go to the next slide, I think, as we wrap up this part of our conversation is the whole ecosystem in terms of our the biodiversity of our planet. We just had a few points to talk about with that, but I think we wanted to make a point about organic. Do we need to do organic or don't we need to do organic? And Jean-Marc, I know you had a couple points about that, so I wanted to turn
We
that
don't
back
want to
to you.
be exclusive, right? Eating organic, in an ideal world, if you could eat organic, yeah, that would be great, it'd be wonderful. But we could not all eat organic because it takes 3 to 12 years to turn some ground where you have pesticide and chemical in it in order to make organic food. So it's practically impossible. The good news is that they have now, like if you go to Europe, if you go to a garden store in Europe, you cannot buy synthetic fertilizer, synthetic herbicide. Everything is biodegradable. And so it can be done. You can actually use fertilizer that is biodegradable and all this chemical. But we could not eat all organic. So it's also expensive and sometimes it's not available. So we want to do the best we can. If possible, definitely support organic, right? If you can't, just be careful with what kind of vegetables you have. For example, if you use potato, a lot of the chemical are in the skin. All you have to do is peel the skin. Well, you lose the nutrient, but at least you don't have all this chemical. And the same thing with apple. Sometimes you have, I think it takes like 16 different chemical and insecticide to make apple. On their own, the chemical are not bad, but when you combine them, sometimes they mimic hormones. And this is why you have all this breast cancer and prostate cancer that are hormone-based cancer. So if you eat an apple as an organic, just peel it. Um, and but try to support organic is very important. Sometimes you can buy some organic bread or flour or things like this, because organic promotes biodiversity, and biodiversity is absolutely essential to our planet. Just imagine a world without bees and butterflies. All right, we can go to the next slide. So yeah, USF, we actually bought the oldest organic farm in California. And interestingly, 35 years ago, I used to buy salad from this farm. And they were the first, it was a bunch of hippies who did this farm, and they would come to your kitchen and they would sell you those baby greens. And they were the first to develop this baby mix green that you see everywhere now. They actually were the first one to market this. And they do have the best greens and salad. They are in the farmers market, and they're absolutely wonderful, and we just love to work with them.
Beautiful pictures. So if we go to the next slide, Jean-Marc, I think in terms of time, we may need to skip this slide, just really reinforcing the biodiversity of our planet yet again. And the next slide, please. We talked about the world without bees and butterflies, imagine that. And then really going to the next slide here in summary. So when we really think about all the things that we've talked about, the world in this midst of a health crisis, from the chronic disease, the metabolic dysfunction, the highly processed food epidemic, all of those things put together. Unfortunately, the deaths that are caused by those are more devastating than the current COVID-19 pandemic. It's costing way too many lives being lost, and certainly trillions and trillions of dollars every year. And when you think about the amazing advances that clinical medicine has produced, it hasn't fixed the problem, has it? You know, I think we've been able to clearly see that through what we talked about today. So we really need to look at what are those factors that we do have control over, right? I think that's the positive message there. What can we control? If we go to the next slide, we're really talking about slashing our risk of every major chronic disease that we've been talking about by an astounding 80%. So really, this health crisis is completely preventable, and good news, delicious, right? So when we talk about that, it's those healthy foods that we've mentioned, definitely putting in regular physical activity, whatever your definition of that is for your own self, finding things that you like, and certainly finding ways to manage the stress that we have. We all have it. Stress is a natural part of our life. It's how we respond to it. And I think hopefully you've learned through today everything we talked about some of the gut connections to that in our brain. So lots of good things I hope that you pulled from this. I know, Rebecca, you needed a little bit of time to have some discussion at the end. So Jean-Marc, I wanted to know if you wanted to do the gastronomy piece next.
Let's do this next, and then we'll go to the question.
Make that connection, the table and the bridge in our health. We got to know about that.
So the bird of restaurant, as we talked earlier, was also the bird of gastronomy. Gastronomy, the art of the table, is a bridge across people and should be a bridge to health and wellness. Next slide. This year, 11 Madison Park in New York, that was voted the best restaurant in the world and has been awarded 3 Michelin stars, will no longer serve meat or seafood when it reopens. Daniel Hum, the chef, said, "The current food system is simply not sustainable in so many ways." That's amazing. That's like the best restaurant in New York. It totally went plant-based and focusing on healthy ingredients. San Francisco, the shiny city by the bay, with the most beautiful bridge in the world, is the best place to celebrate gastronomy. We hope you can visit us at the University of San Francisco, and we wish you a healthy and delicious life. Let's move to the question.
Thank you, Jean-Marc. So as we go to our final slide before we do some wrap up pieces there. I think I think it's clear to everybody that the same type of eating style that protects our planet protects our health. And we hope we've inspired all of you in some way, shape, or form to think about this message in a different way. If you haven't already started to adapt that into your own lifestyles. And we had just a few things that Rebecca wanted to wrap up in case you're interested in learning more. So Rebecca, I'm going to turn it back over to you. Thank you, everybody.
Sounds great. Wow, what a wonderful presentation. Very educational for me personally. We had some great questions. So I love this one. We probably won't answer all of them unless people want to stay a little bit later. But is it too late to begin eating healthy for those of us who are advanced in age? And I know this gentleman, and I don't think you're very advanced in age. But, I thought that was a great question for all of us. So I'll pose that one.
And if you don't mind, I'll take that question. And absolutely, it's never too late. And I think, if you think about your gut health, just changing how you eat within a 3 to 5 day time period, that gut microbiome can begin to turn over into a healthier colony of gut bacteria. That's just one small example. Many, many years of helping people. It's so inspiring to see the changes that people can make. Small changes that you're able to, everything that Jean-Marc and I have talked about today is really try not to view it as a diet, but more as a lifestyle change. So really evaluate where you're at today. And if you can make some of these changes and little by little stick with them and then make the next change and the next change, you will improve your health. It's never too late.
Yes, I used to work for Dr. Ornish doing research on heart disease, and we had patients that would come in that could barely walk, barely cross the dining room, and then once they start to eat healthy, within a month, their health improved completely. So yeah, it's never too late, and you will feel much better if you eat healthy very quickly.
And the way you feel is so worth it. The energy levels and just how you are able to get through your day. It's wonderful.
Yeah, we have another question around fasting, intermittent fasting. And I didn't know if you had anything that you wanted to respond to on that.
Yeah, so I'll take it for a little bit. So there's actually real recent science talking about some of the value of intermittent fasting. And so it's really a new, fasting is not new, but the value of it to our health, I think, is being researched in a new way. That's probably a good way to say it. And so there is some value to it. I think you have to really know what you're doing. So stopping eating at a particular time of the evening and then not eating, there's a couple different styles of this, and we probably won't have time tonight to get into all of it, but so not eating for a 10 or 12-hour time period and in other scenarios that really can benefit your health. You don't want to get into fasting for days and days at a time. And so you want to nourish yourself well, and then maybe you go to bed, maybe you're an early to bed person, and then you don't eat to a particular time in the morning. And I have to preface that by saying too, if you're someone who has diabetes or some other condition that really requires you to eat in the morning, so I have to be careful how I answer it based on that. But there's value. It just needs to be done in the right way.
That's great. And then one other question, a couple of questions popped up about spices. And I know, Jean-Marc, you had some thoughts about the different types of taste buds and so on. I mean, is there anything that you want to, because I think it's helpful for us to think again about that whole deliciousness component, right? So how we make things delicious that we may historically think of as being a chore versus a gift, and really making that switch. Did you have any thoughts that you would mind sharing, Jean-Marc?
Spices, yes, spices are very important. I mean, in the old days, spices were used as medicine. If it's in Chinese food, or also in the Western food as well, a lot of thyme, basil, bay leaf, they all have property and they're actually good for you. The most biggest spices right now is turmeric, and that's so good because it's so anti-inflammatory. And then if you combine turmeric and pepper, you will absorb those anti-inflammatory property even more. It's also very good to eat food that's well seasoned, because the way your gut communicates to your brain, if you eat really good food that's well seasoned, your gut will communicate to your brain, oh, I'm getting some food. But if you eat some bland food, your gut gets like, okay, it's bland, those things happening, and then it takes forever and you eat so much more. So it's very important to eat some well-seasoned good food.
Well said. Fantastic. Well, I know that there's just so much more that we can cover. And I apologize we didn't get a chance to get to everyone's questions. You know, we talked a lot about these topics today, the top three. We could go into more depth on all of those. And then also these bottom three, really talking again on culinary techniques that maximize flavor. Again, the science between the taste and flavor, and menu designs, as well as some of our you know, innovations and best practices for food safety. What we found is that there's really like a few different audiences that are interested in learning about this information. We have culinary experts and chefs in restaurants who may be designing menus and wanting to market and communicate those. So we'd love to hear more from you all if you would be interested in talking more about that or getting more information from that perspective. We of course have nutritionists and dietitians and other people in healthcare who are, you know, supporting their communities and wanting to help us all with this just massive challenge that we're all facing, which is how we minimize those chronic diseases that are in so many ways preventable. And then we have audiences of people who are, you know, working in organizations, and of course with those healthcare costs skyrocketing, you know, every company that we talk with, you know, wants to decrease those costs by helping all of their employees eat well and be healthy and help them and give them tools associated with that. So I think you'll hear much more from us on this topic, but we'd really like to hear from you as well. So if you are interested in any of these kind of customized programs, then please do reach out to us. This is some of the ways you can get a hold of us. The easiest way, of course, is just via email, our executive education immersion email, and we'll be able to kind of talk to you. But we are, you know, Jean-Marc and Marlene have done some great work here and have a lot more knowledge to share, and would be very interested in sharing that with you in the format that's most appropriate. So we will also follow up with the survey after this to hear more about what maybe you as individuals who are planning your family's menus would be interested in learning about, in hopes that we can do a follow-up workshop. And again, just provide you with more answers on this really dynamic topic. But with that, I really would like to thank you, Marlene, and thank you, Jean-Marc, so very much. For me personally, I just feel like you have added, you filled in so many gaps to some information. We get so much information. We hear about omega-3s. We hear about, you know, prebiotics and probiotics. We know what a lot of times we know what we're supposed to eat, quote unquote, and may or may not be successful in that on an everyday choice basis. So for me personally, I just find it really interesting, and I hope everyone else did as well, to try to make sense of all of this, and with the knowledge that we can change this and we can redesign our kind of relationship with food. So I just wanted to close by saying thank you so very much.
You're welcome. It's great pleasure. Really an honor to be here with everyone. Thank you for attending.
And thank you all for joining us. And I see some great notes from everyone. So we will be in touch, and we look forward to hearing more about what you really like and enjoy, and how we can help you further on this. So
thanks, everybody. Have a great rest of your day. Bye-bye.